Donor areas like this can really tug at the heartstrings. They are the unsung heroes of a successful hair transplant, tucked away at the back and the sides of the scalp, where hair follicles stand strong against the relentless tide of androgenetic alopecia. These resilient follicles are your golden tickets, harvested and transplanted to replenish thinning or balding spots. But here's the catch. This precious resource is finite. It is not limitless. And if not managed with care, it can slip through your fingers like sand. And now consider such disasters. Unfortunately, when it comes to donor management, many practitioners are playing with fire without even knowing it. For the stakes are high. The race to get as many grafts as possible, trying to pander to every need of the patient, trying to maximize revenue in the clinic. This poor management of the donor can lead to devastating consequences, permanent deformities which can never be resolved. Besides this, limited options for future hair transplants and aesthetic results that leave much to be desired. This video dives deep into the nitty-gritty of donor area management, shining a spotlight on why a strategic approach is vital for long-term success of a surgical hair restoration. The donor area is not an endless wellspring of hair follicles. On average, you're looking at 6,000, 6,500 to 8,000 follicles in a lifetime in a person who has a better than average scalp donor. And this number fluctuates based on various factors, various variables, like hair density, like scalp laxity. And mismanagement can lead to overharvesting, biting off more than a hair transplant surgeon can chew. Extracting too many follicles can leave the donor area looking moth-eaten, looking patchy, abhorrent to look at. A responsible surgeon should keep his eye on the ball, considering not only the patient's immediate needs, but also the likelihood of future hair loss, because baldness isn't stable yet. Baldness is an ever-evolving process. It's a dynamic process. Till such time the gene of baldness goes to sleep, you have to be extra vigilant. It's all a balancing act, playing the long game to ensure that donor areas remain viable for future sessions. Now let's address the elephant in the room, overharvesting. It's often whispered in hushed tones, but is one of the most common pitfalls in poorly planned hair restoration procedures. In follicle unit extraction, that is FUE, surgeons use tiny punches to extract follicles with skill, with finesse, with dexterity. However, if they go overboard or become too greedy and remove too many grafts, the donor area can take on a moth-eaten appearance and lead to a chain of events. There are three things that can happen after overharvesting: visible thinning, unaesthetic look. The donor area may no longer blend seamlessly with the surrounding hair, especially noticeable when you trim your hair short. Next, donor depletion. Patients facing severe hair loss may need multiple sessions down the line, but an overharvested scalp donor can severely limit these options. And lastly, permanent shock loss. When you harvest too close, you're likely to damage adjacent follicles. Follicles which are not being targeted, but at a deeper level are being harmed, are being traumatized, that they permanently fall off. This is called permanent shock loss, and this can be devastating to the scalp donor. A skilled surgeon knows that balance is key. He will carefully distribute the extraction, spread it out over the entire scalp donor, and maintain a ratio of extraction of no more than 1:5. That is, of every 5 follicles, only 1 will be harvested, ensuring uniform density across the donor area and thus minimizing risks. Hair transplant, after all, is not a one and done deal. It's a lifelong journey, since baldness is ever evolving, and this requires foresight and planning. In both FUE and FUT, some level of scarring is inevitable. The visibility of these scars hinges on surgical technique and patient healing characteristics. In FUE, tiny circular scars are left behind if extraction techniques are not up to the mark. Hypopigmented pits may be visible, and on the other hand, in FUT scars, this can get worse if these linear scars stretch beyond what the surgeon had catered for or the patient imagined in his worst dreams, if the hair transplant is not executed properly. Shock loss can be a bitter pill to swallow. While temporary shock loss is common and usually resolves within a few months, permanent shock loss occurs when surrounding hair follicles are irreversibly damaged during the process of extraction. An experienced surgeon minimizes trauma by employing refined techniques that balance graft extraction and the donor area's ability to heal. Hair transplant is not just about immediate results. It's about planning for tomorrow, for the future. Poor management during an initial procedure can severely limit future options as baldness progresses. Strategic harvesting ensures that grafts are extracted evenly across the donor area while conserving enough grafts for future needs. In cases where donor areas are poorly managed or insufficient for patient needs, alternative sources like body hair transplantation BHT may be considered. However, body hair in isolation doesn't often blend seamlessly with scalp hair due to its different characteristics. Patients have a greater skin in the game. Proper wound care and lifestyle choices like avoiding smoking, maintaining proper nutrition can significantly impact donor healing and donor area health. A thorough preoperative consultation educates patients on preserving the donor area and taking proactive steps towards its longevity. At its core, effective donor area management is about more than extracting just grafts. It's about preserving natural appearance and ensuring long-term viability. A skilled surgeon treats this vital resource with respect, employing meticulous techniques and long-term planning to make every graft count. After all, a hair transplant is not merely about moving hair. It's about restoring confidence and crafting results that stand the test of time. Because once you've missed a chance at preserving the donor area, there is no going back. So thank you for watching again. If you have any questions about the donor area, about hair transplants, about hair loss treatment for men and women, do let me know. Leave a comment in the comment section below and I'll get back to you shortly. Have a nice day and God bless you.